Hey, Reluctant Preppers, you could have been watching this video the moment it came out.
By going to HealingYourself.Life and subscribing to our new sister channel, Healing Yourself. See you there. HealingYourself.Life provides information for awareness, educational, and support purposes only and does not diagnose or prescribe treatment for any medical condition. Viewers are encouraged to do their own due diligence and consult with their own medical caregivers before making personal treatment decisions. Welcome back to HealingYourself.Life. I'm your host, Dunnigan Kaiser.
And I'm Melody Kaiser.
We're here with Dr. Elaina George MD, visiting us again for a second time. Dr. George, thank you for joining us again here on Reluctant Preppers and HealingYourself.Life.
It's a pleasure.
Now, Dr. George, for those of you who are joining us for the first time, is not only a talk show host, she's also the author of the book Big Medicine and has a radio show, Medicine on Call, online. And Dr. George is here with us to talk about medical perspectives on what's going on wrong with our health system and what we can do about it. We've got so many topics that we're going to have to pick just a few to address tonight. And we thought, since we just made it through the midterm elections and there's such a national discourse over the past several years about the promise of universal medical coverage for all, versus, and sometimes that comes wrapped in the mandate that you must participate in a certain way in the plan, and second of all, there must be a single centralized single payer. And if you could walk us through, are there benefits of that? Is there promise that comes from that? Or what are the pitfalls of that, how they affect not only people, the individual who's trying to get proper care, but also doctors and how they're permitted to practice and the kind of care that is available?
Absolutely. I think the short answer is there is no benefit to single payer. Medicare for all is literally the finishing off of the bailout for the insurance industry, which started under the Affordable Care Act. You know, the bottom line is our healthcare system using the insurance model is overpriced. It's based on false charges, and it's about graft and kickbacks and rebates, and they're all on the backs of the doctor and the patient. And the single-payer system will do absolutely nothing to change that. I think healthcare is a service. It's not a right, because when you call something a right, then someone's going to get to decide the value of the patient, the value of the physician, and the fiduciary power goes away from the two entities that it should belong to. The patient is the consumer, and if they don't know what the cost of something is, for example, they cannot make a conscious decision. And then you have the other side where the corporate interests are driving the entire healthcare system, and you have to follow the money. They stand to gain by having sick people take a medication or more every day for the rest of their lives. That's the system that we're under. And it's not healthy. I mean, if that were the case, why is the mortality rate dropping every year since the Affordable Care Act passed? Why are seniors living less quality health care?
Did you mean the mortality rate? Did you mean the mortality rate dropping or the life expectancy dropping?
Well, the life expectancy dropped.
Okay.
Wow.
And it's every year. And if we're on more medicines and we're in the best system in the world, why on earth is that happening? In my opinion, we're paying more and getting less. And it's not about healthcare anymore. It's about control. It's about data. And as long as we use the emotional stick of, if you don't want this, then you want someone to die, everybody's falling into that trap, because we're decent people. Everybody wants to take care of everybody. I mean, that's the honest truth. And people are using that against us. So if you have a question and you raise your hand and say, excuse me, but this doesn't sound right, they shout you down as racist, sexist, you name it. And I think it's time for good people who know that they're not these isms to stand up and say, I don't care what you think, I'm not doing it. Because if we were to do that, it would stop tomorrow. I'm sorry, that's kind of a long answer to your question.
That was great. That was awesome.
Getting wound up there. I was thinking, so maybe you can take us into what are, from a patient standpoint. So when you said there's no win, people don't win, there's no benefits from single payer, I thought, well, there's plenty of benefits for Big Pharma, big hospitals, and health insurers.
Right,
Those are the three winners.
Absolutely
but the patients and the doctors are the ones that are getting squeezed out.
You know, as I said at the beginning of the show, you said I have a show called Medicine on Call, and I interviewed Charles Blahaus. He's a fellow at the Mercatus Institute, and he used to work for administration, the Obama administration, as well as the Bush administration, on Social Security and Medicare. And he actually, his show was fascinating because he explained exactly the problem, unemotional, just the facts, not a winner or loser, but just how it was going to roll out. And he said that once, if God forbid, Medicare for All passes, right off the bat, there'd be a 40% decrease in the reimbursement for physicians and any healthcare provider. Wow. As an independent doctor, I'd be out of business tomorrow if they did that, as well as with the rest of my colleagues. And I can tell you the hospitals wouldn't be practicing or wouldn't be open very long either. And it's already unsustainable. It's already paying people in a manner that they can't afford to stay open. And that's the main reason now that you're spending 7 minutes with a doctor, because they have to see volume in order to make up the difference so they can keep their doors open. And the system is broken. Why are we doubling down on that? And to top it off, he said, there would never be another private insurance company because as it's written, any health insurance company cannot offer the same services that Medicare offers. So they can't duplicate them. So that means by definition, they're gone. They're gone. They're done. So now you have just the government running everything on a system that's already bankrupt, and they want to add in everybody, not just the seniors who are already hurting because they can't find an independent doctor. They have to wait forever. They're getting pushed in and out. And that's how, I mean, that's just to digress. That's one of the reasons we're seeing telemedicine and the digital side of this, because you have to see them. But the hospital's losing money every time they admit somebody who's really sick. They don't want to admit them anymore. They want to put them in hospice. They want to put them in skilled nursing facility. It's all about the money. And it's a peculiar incentive that's been set up under the Medicare system now. The hospitals make more money if they do not admit you, if they treat you as an outpatient, if they virtually manage your care versus admitting you.
So how are they making, I was just going to, sorry to interrupt, but how do they make money? I always think you have to be admitted for them to make money, and then they're charging you $500 for aspirin or whatever.
Okay.
How do they make money as an outpatient? I don't understand
let me tell you how that works.
Yeah.
If you do get admitted, one, under the Affordable Care Act, this is one leg of their payment scale. They have to discharge somebody in a certain amount of time to get their DRGs, the amount of money that they're supposed to get from the government. They cannot readmit that patient within 30 days with the same diagnosis, otherwise they won't be paid. So that's making them get people in and out quicker. Then you add in those of us who have insurance, and let's say the bill is $100,000. The insurance company pays $20,000. The hospital has the ability to go to the government and say, hey, we lost $80,000 in care, and they get that back from the government. So this is a complete racketeering system, and it not only applies to the hospitals, but it applies to the insurance companies too. So let's say you're an independent employer and you have an ERISA plan, self-funded plan. So you have your employees on it. You get your care, let's say, again, $100,000 worth of care. That person goes to the hospital, and the insurance company pays $20,000. Meanwhile, it was only worth about $2,000, by the way, so totally overvalued. So what the insurance company will go back to the employer and say, we saved you $80,000, and they get a percentage of what they said that they saved the employer. So this system is based on make it as high as possible to get the biggest reimbursement, the percentage. It's never going to come down. And under Medicare for All, they are doing nothing to stop that system. So we as taxpayers will finally be the last piggy bank that they raid to make the system work.
And you're right. In the beginning, you said anybody who objects to these substantial claims, and everything you're saying rings true. It's horrifying.
We've experienced it, and I think that's the thing is people are getting to you can't. It's unsustainable for the taxpayer too to be funding this. You can't do it. We can't even pay our own healthcare bills, because they're so out of there, and then taxpayers are being build again. That's I didn't know that.
But then you pointed out that anybody who objects to the structural inequities in this and the distortions and the corruption that this is setting up for is beaten down with this emotional argument that you must not want, because it's being cloaked in that the reason for all this being necessary is to make sure that all underprivileged people and all people who can't afford care, everybody deserves care. So it's always touted and actually blamed on the people who, as though this is for the common person, this is for everybody's good. But in fact, it has nothing to do. It never was. It sounds like it's not designed at all to really benefit the individual.
Or the doctor.
Or the doctor.
Could you turn to that, maybe that topic? I guess we can come back to this maybe with how it affects the individual, but maybe we should look at how it affects physicians as well. You mentioned your hand being forced on what level of care you provide, or else subsidy would be withdrawn or payment would be withdrawn, and maybe you can tell us more about that.
Well, from a physician standpoint, there are two avenues now to practice medicine. One is independent, where you still have your own practice, you hang out your own shingle. Sorry. The other method is to sell your practice to a hospital. And when you do that, you lose the ability to take care of your patient. When you have your independent practice, your fiduciary responsibility is to the person sitting right across the table from you. You tell the patient what it's going to cost. They either agree or they don't, and that's the end of the transaction. But when you're in a hospital setting, it's the hospital that becomes the arbiter of that. And you're in a system now where they don't tell you what the cost is, where they make up charges, where there is facility fees, totally arbitrary, which I still, to this day, don't understand. If you own a CT scan as a hospital, why on earth do you get to charge for use of the scan, reading of the report, time in the facility, in the room getting it done? All this stuff is completely ridiculous, right? So there's nobody stopping them from doing that. So what the hospital has done is make the doctor the donkey, for lack of a better way to put it. We're here writing prescriptions, admitting patients, making sure the charts are correct so that they can actually receive their money from the insurance company and the government. And if we don't do it, we're considered to be disruptive. We'll have sham peer review come after us. And that means if you become a disruptive physician, you may never practice medicine again, because they ask for that every time you re-credential. Have you ever been, have you ever had any kind of bad interaction with your hospital? Have you been, put under any kind of suspension? You have to answer those questions, and it will follow you for the rest of your career. And it's not true. Just because you cared about your patient, you wanted to keep them in an extra day. You thought they needed an extra blood panel because you weren't sure. That's what makes you a disruptive doctor. Not being rude. It's about caring for your patient. They've now become mutually exclusive. And anybody with a conscience really doesn't want to do that anymore.
Right. So how does that? Because each doctor, you have to have some relationship with a hospital, I'm assuming, in case you do have to admit. How do you do that when you get in trouble, with the hospital? How can you pick your hospital? If they're more doctor-friendly hospitals?
Well, they actually have something called hospitalists, and these are doctors who are employed by the hospital who take care of the patients when they're in the hospital. So now that's another problem with the system. You can admit a patient, but you don't have control of what happens with your patient once they enter that door. And I've heard of doctors, oncologists, for example, who have their patients admitted. The next thing you know, they're in hospice, and they never wrote that order. I mean, it's just some tragic things that are going on in the hospital. And the bioethics panel, who bypass the patient's living will and just make a decision without talking to the family. This is no longer a friendly, patient-centered environment. It's about the money. And I recommend that anybody, God forbid you have a loved one in the hospital, you have to have somebody stay there with you. Ask questions about who's coming in and out, what they're giving, what they're doing, and what the plan is, and make your presence felt. Because a lot of things are now happening without the help or without the knowledge of the family, and that's completely inappropriate.
Wow.
One example
just completely
of that
eye-opening.
is
Go
people
ahead.
being shunted off to hospice or discharged from the hospital prematurely. Another rather extreme example of that, we interviewed Dr. David Byrne, MD, yes, about organ donation, and that's another thing that's very touted. If you look at, just do a little gut check, people, and think about all the signs, the ads, the posters, the TV coverage, the people on your local news channel, all the discussion you've seen about organ donation. Have you noticed that it's all pro-organ donation, all of it? And they're not telling you about times that the family is shunted off to the side, or the person's living will is not consulted, and that sort of thing. It can be a very dangerous situation.
And I think that people aren't aware also that above, I don't know, it's equal to or about the same as the abortion industry. People, they're making huge amounts of money.
The financial impact of it.
There's a financial incentive for people, for the companies who deal in organ donation to get your organs, so you're not treated.
Follow the money. Follow the money, right?
Right. Follow the money.
There's another thing that people may not understand or know is that when the doctors admit a patient and they lose control of that patient, that's one thing.
Yeah.
When they enter the hospice system, the Affordable Care Act, literally, when it was written, it paid for hospice doctors and medical technicians and nurses, but not for medical education. So you have to think about what their onus was. If you're paying for hospice doctors, what's up with that? It's not about care anymore. It's about making you comfortable. And this is the tragic. I had a colleague on the show who talked about how people are being admitted to hospice and being discharged from hospice, which means they're not sick enough to need the hospice in the first place, and they're outliving the time that they should be there. There's a question mark as to whether that system is really a money-making venture, get the patient out, keep the money kind of going in the system, but it's not about patient care. You're not going to get the hip replacement. You're going to get a trip to the hospice. Please, people, ask questions. And I really recommend, if your doctor doesn't want to talk to you, doesn't look at you, doesn't give you an answer, vote with your pocketbook and your feet and find somebody who's really patient-centered, not just because they're in a big, huge, monolithic hospital.
I don't think we shared this story the last time we spoke with you, but stop me if we did, about an acquaintance I have who had open heart surgery, and it was extraordinarily big surgery and very, very costly and everything. But then afterwards, I got a really good cardiologist who said, you need this specific medication to avoid having to have any repeat of the surgery. But the insurance company wouldn't approve that medication because it hadn't been FDA approved yet for use all by itself. It had to be used with this other type of drug, which he couldn't have. I think the other one was a statin. He couldn't have that because it caused these terrible muscle cramps, and he couldn't have that. But they said, well, that's what our standard of care is, and you can't have that unless you take the other one. So he had to go through this excruciating period of like 2 years of trying these different kinds of statins, and each one causing him all kinds of trouble. And finally, his doctor, it was like the last resort, and then the FDA finally approved the one drug, and so the insurance company said, okay, now we have to. They were fighting it, so they had to pay for it. And he asked them, he said, all along, he said, you could have approved this. It would have been so much less money if you'd have done this, because I was at risk of going in.
Yeah, another heart attack.
Heart insurance, or heart surgery. Mm-hmm. And the insurance person dropped the facade and dropped the armor for a minute and said, well, actually, as often as people change companies that they work for, employers, you might end up on a different insurance company, or even employers will change insurance companies. So chances are you're going to end up being somebody else's problem if you needed to get heart surgery again, not our problem. So we have the policy that we have to try to keep our costs down, and so we're going to just have you take the medication instead of getting the. So even though it might have led you to get more risk of repeated heart surgery.
They don't care about that. Mm-hmm. And actually, the more expensive the procedure is, the more cost that's written into that patient's care, the better they like it, because they have the social mindset, or whatever, they've mind control folks to think, hey, you wouldn't have been able to afford it without us, so we're necessary. When in actuality, they're the reason that it costs so much. Had that patient gone cash pay, I wonder if they would have paid that same amount. for that medication that they tried to get from their insurance company. And thank goodness the gag rule under the new administration is gone. So now every pharmacist can tell a patient, this is how much it would cost if you pay cash versus using your insurance plan. So people can stop being gouged. It's a completely ridiculous system with the pharmacy benefit management companies, that the GPOs that buy the hospital, supposedly save the hospital money, where everybody's getting a payback. I mean, this is like payola on steroids, but the cost is crazy, and it's legal. If the government would just do a couple of things, I think this would stop tomorrow. Get rid of the safe harbor anti-kickback rule so they can't rebate each other. So that means that the Big Pharma will, the pharmacy benefit management company will go to Big Pharma, get their drug, pay for it at a certain amount, and then give part of it back to the pharmacy, the Big Pharma company, and to the insurance company, and to the pharmacy. There's so many hands poked out, and that money is completely legal. It should just get rid of that. They need to get rid of the fact that these insurance companies are practicing medicine without a license. Your friend might have had a bad outcome, and you could not sue the insurance company. The doctor would have been sued, and the doctor was fighting tooth and nail to get that care for the patient. But we're always the one holding the bag when we don't make all the decisions. They take that power from us, and that's not right. If they're going to practice medicine, they need to be sued.
You're making a very good point.
Yeah, very good. And I think that, well, go ahead.
I was just going to, another acquaintance who had suffered a severe head trauma and their doctor said they needed surgery in order to remove this recurring pressure on the cranial nerve, and the insurance company denied the surgery, but they said you can just go in and get a cranial nerve block when it flares up. So now routinely, it may be a couple weeks, it may be a couple months, but has to go in and take days off of work and get a cranial nerve block, and then be decommissioned, completely out of commission for several days, and finally get back to normal again. And that's just this vicious cycle that keeps going because the insurance company said, we've decided we're not going to pay for the surgery that would have relieved this permanently. And I'd never heard it put the way you just put it, that the insurance company is practicing medicine without a license.
Oh, definitely.
They're overruling
the
doctor.
Me that it's awful to tell me that something's not medically necessary when my ENT national board has a standard of care of when I do balloon sinus dilation, when I do a septoplasty. I'm not just doing it. I'm doing it because it meets criteria based on our training. And for an insurance company, which is, they have a conflict of interest here. They're not interested in whether it's necessary. They just don't want to pay for it. And they're allowed to use the term not medically necessary or experimental when it's not. Allergy treatment is not experimental. Allergy shots are not experimental. But we've been denied based on the insurance company. And if you guys only knew how hard it is to practice medicine, you would be appalled. It changes quarterly, and they don't tell you. So you're doing something with the right code. Next thing you know, they stop paying for it, but they never told you that, hey, we changed the rules after the fact, and you only have 2 weeks to submit your claim. Otherwise, we're not going to pay it. I mean, it's horrific. It's a complete one-sided playing field. And
it's so absurd. And I guess what can our listeners, and I'm sure you're working with other doctors too, of what can the average person do to change this system? Is there a way to start an organization where we can petition the government to say this is not working for the patients, this is not working for the doctors? What can we do now, and I guess what can doctors do as well?
Well, the first thing to do is to take your own power back. I don't personally believe that me petitioning the government is going to do a darn thing. I've been up there.
Okay.
I've told them what it's like to be a physician, and I was told by an aide, if you tell a congressperson that it's causing you pain, that you're inhibited from practicing medicine the way you were trained, they think that's a good thing, and they will double down on it. They could care less. They can't stand doctors. I don't know why, but there's a real hate for physicians on Capitol Hill. But what I would say to everybody listening is you do not have to reinvent the wheel. There are physicians like myself all over the country that you can access now. Here in Georgia, we have something called HIP Nation, HIPnation.com, and it's a consortium of direct primary care, independent, family practice doctors, and specialists. And we all work together. For $100 a month, that patient can go to any direct primary care doctor, get their medications practically for free, get their labs, their EKGs, everything is done in the doctor's office. And if they have to be referred out to someone like myself, an ear, nose, and throat doctor, I have a flat fee. For $395, for example, it includes telescopic examination, the consultation, scoping for nose or throat, and hearing test, etc. So I'm trying to keep it as reasonable as possible, but I would rather get it at the time of service than wait years sometimes or never be paid. So we're here. We're ready to see our patients. And the way you break the system is to stop using it. All they understand is money. So if you go to an independent doctor instead of the doctor who sold their practice, if you go to a freestanding radiology center, a freestanding lab, and stop using this crazy system, they'll get the hint. And when they have competition, they'll have to drop their price. But what they really want you to think is they're the only game in town. And if you don't have health insurance, you're going to die, which is kind of the opposite now, if you really want to be honest. Because if you have something catastrophic, they'll say it's experimental, not covered, waiting forever to see a doctor. Next thing you know, it's stage 4. It's not a good system.
What you're saying, there are examples. I know in Toledo, Ohio, they have the Toledo Clinic, which is actually a consortium of doctors who founded that together. A group of doctors got together and they're co-partners in forming this physician-centered and patient-centered practice. So it's actually, in addition to the model, and we've also seen several caregivers who are independent, cash for service.
Right, cash for service.
So that's absolutely true.
Well, now this Hip Nation sounds interesting as far as, for our viewers. How can they, in their own states, obviously not everybody lives where you live and not everybody lives where we live, as far as being able to find those doctors that they can see on a for-fee basis and to, just get the insurance companies out of out of their lives.
Absolutely. I agree with you. You can go to my website, drelainageorge.com, ELAINA, George like the man's name.com. I have links to different organizations that do exactly what you just described. There's a website called jointhewedge.com that's based out of Minnesota, but it lists nationwide all sorts of practices who have a cash base, and it's all about privacy. So the doctors on this site will not share your information. HIPAA is totally a joke anyway. It just means everybody can see your private information. But in this system, every doctor is about patient privacy. So nothing's online, nothing's in a cloud. They're not going to share your information with anybody. And again, it's price transparency. You know exactly what it's going to cost up front. And their doctors here are all over the country. You can actually there's little pins that you can just click on it and find a doctor in your location, in your city. You can go to aapsonline.org. That's the American Association of Physicians and Surgeons. It's the independent doctors, the answer to the AMA, but for independent doctors. And again, they have listing of doctors all over the country in all specialties that have a cash-based practice, that barter, that actually have price transparency so you know exactly what you're going to get. Another little pearl is something called Surgery Center of Oklahoma. And they list their surgical prices online. And they include everything from the time you walk in to anesthesia to the time you're discharged. And they've had such an impact in their city that the hospitals are now dropping their prices to compete. That's how you win this system. Be the alternative. Let everybody know you exist, and patients need to be savvy consumers and stop just accepting anything that they're told. I mean, you're being lied to 24/7 about the cost of healthcare, about what constitutes healthcare. Because in my opinion, it's not a drug, it's fixing the problem. So if someone wants an easy pill for things, I really feel for them because they're not getting better. They're just getting managed. And I don't think that's the way that people should have to live. But it should be about choice. So if you like the Affordable Care Act, unfortunately, it's still here. You can have it. But if you really want not to do that, this is how you play the game and win.
I this really has struck me because my first instinct is fear of, oh my gosh, I can't go outside the system because I've been taught my whole life, you need insurance because you need the safety net. And then I realized, well, there were many cases in our lives where we have opted out. We did homeschooling and we had 2 home births out of our 5 kids, and we kind of opted out of different systems, and this is just another way of going, yeah, we got to take control of our own health and get the health insurance out of the being so intrusive into our lives. The health
draining us dry.
Yeah, and going to it's just it. I must admit, though, I have that fear of, oh my gosh, what do I do then? What do I do now?
Well, We've been indoctrinated.
Well, right, that's true. That's exactly. Absolutely true. But so just for the sake of discussion, let's respect one element of that as we talk about this on the Preparedness channel. You have a plan A. Plan A is I'm going to live a healthy lifestyle and I'm going to get independent care. Great. Now, what happens if, unfortunately, you get hit by a truck or something like that? So what's the downside if you, in other words, paying for, and we've been paying triple. We've been paying for the, won't call it traditional. It's the modern medical extortion system. We've been paying that full high premium. Okay, then we've been paying for the cash care by independent carers, and we've been paying doctors. Pretty darn high costs for expensive supplements, herbs, all that kind of stuff on the side. Yes. Now, if we say we can't continue to afford all that stuff, so we're gonna have to drop if we drop the modern medical insurance, then I know you talked to us in the past about some other alternative non-insurance, that sort of thing. Maybe that's the answer. Maybe I'm reminding myself you've already answered that question for us, but because that's the question.
Go ahead.
Let me re-answer it because
it's important.
There's so many different ways to do this. I'll give you myself as an example. I chose to do Liberty Health Share as my Christian sharing ministry. It's what the title of it is. But this particular sharing ministry opens it up so you don't have to be a member of a particular parish or church. You just have to follow Christian guidelines. And that means that it's more of a libertarian mindset. But what they have is the ability to cover big ticket items. So with my plan, and I have the most comprehensive version as an individual, it's $250. Anybody over 30, it's actually less if you're under 30. It's a total of $1,000 a year as my shared amount. And I'm covered up to $1 million per incident per year. And I can tell you, as a small business, I put my employees on this because I couldn't afford the typical insurance. We got priced out really quickly because we're so small. And they've had back surgery, admitted to the hospital in an ICU at one point, and it was all paid for by Liberty Health Share, including the ambulance, ride to the hospital. So I've seen it work on that side. I decided that I wanted to be even more savvy, and I added AFLAC as a supplemental policy for my folks. So now we actually get paid, literally, to stay healthy. So we get paid if we want to get a mammogram. You get money back for a colonoscopy. If we get diagnosed with something really crazy like cancer or stroke, we're going to get a $250,000 check, no questions asked, written back to us because it's based on the diagnosis. Unlike an insurance company, where they just try to deny you, when you buy an indemnity policy, they're going to pay you. So for $50 a month, anybody, and even less if you just want to cover dental or eye or, cherry pick, you can pay a lot less, but know that if something goes down, I don't have to worry about the money. I don't have to worry about the insurance company not covering me because I'm going to have $250,000 that I'm going to be able to use it for whatever I want to use it for. That's how you win in this system. Okay. Why let someone else control the piggy bank? It should be you, because you don't have choice.
Okay, and is that the AFLAC that you can use?
That's AFLAC.
Wow.
That's AFLAC.
Okay, I mean I see an ad, but I've seen the ads.
I know. You see the duck, you're like, what the heck?
I didn't know.
I know. I didn't either until he came to my office and he started to explain what exactly it was. I'm like, well, why? I'd be stupid not to do it because it's really small amount of money. Wow. And I extended mine to dental, so if I need a root canal, if I need a tooth pulled, they're just going to give me a check the next day.
Wow.
So this is a whole different mentality of I got money banked. That's going to come back to me, no questions asked. And I'm not paying thousands. I'm paying $50 a month, $30 a month, and I know I'm covered. So let's say, God forbid, you dropped your insurance or you lost it. You still could have AFLAC as your go-to for anything big, right? So there's a lot of ways to do this. I just don't think the insurance companies are user-friendly anymore. They've gotten used to making so much money. They've got a free-for-all where they can deny care. Nobody comes after them. They could care less, and I'm tired of supporting that system. Now, on the flip side, you can do something like medical tourism. Liberty Health Share, again, it offers a lot of different ways to do things. You don't have to stay in the United States. You can go and do medical tourism. They will cover it because they know it's all about giving your member what they want. It's cheaper, more state-of-the-art care out of the country in some instances. So they're into it. You can't really get that from an insurance company. There's a company called MedRetreat, which is it's an American company that's geared towards finding you medical tourism destinations for surgery. There's something called Health City Cayman Islands, for example, which specializes in heart surgery and orthopedic surgery. And these are, state-of-the-art physicians. They trained in the United States, but they've gone back home, or they've gone there, and they have the same facilities, but it's a fraction of what you're paying. Even dental, they do dental work there as well. So, 2 hours or 3 hours to go to the Cayman Islands, English speaking, perfectly safe. You can stay in their hotels, get your services done, have a little vacation after, come on back. I mean, so there's so many ways to do this. Why spend $100,000 when you can spend a fraction to get things done? So there's a whole world out here, guys.
Have you encountered that there's a suppression of this message? Because this seems to be a potentially threatening message to get people, because as we mentioned earlier in the very beginning, the rallying cry, or the cloak that gets thrown over people's heads is, well, if you have a heart, you'd care about the poor people, and you'd want everybody to have access to care. And you're pointing out that people don't have access to adequate care. Doctors are being forced out of their decision-making process and so on. So once the word gets out that you can opt out of that system, that's a very dangerous message to those who are liking the gravy train, the corruption that they've got going.
I happen to think that people will only be upset if they're part of that gravy train. But the average person who they're supposedly talking about, right? The working poor, the person who's been disenfranchised, those guys would get it. So if I told you that it would cost you $60 a month as an individual to join a direct primary care practice versus $2,000 in premiums and another $2,000 in deductibles, which one would you pick? Because you'd be able to go to see that doctor as much as you needed to. You'd have telemedicine. You'd have direct access within a day to see them if it's an emergency. Everything that they do is for that $60. So you're not going to pay for EKGs and labs and blood work, and radiology is a discount. They dispense medicine out of their practices most of the time, and that's all rolled into the $60 cost. And you would actually go because you didn't have to worry about, I can't afford it, so I'll just hold on, I won't go. This is a person who's better cared for no matter how much money they have versus someone in the insurance pool. So for those who think that you're being mean and nasty, I say it's the opposite, because the people who are least able to defend themselves are the ones who deny themselves care because they can't afford the $2,000 out of pocket. So who's being, mercenary and cold? I submit it's not us.
Yeah, I think that's so true. It becomes more affordable for anybody to be able to then go see a doctor at a reasonable price and have that ability to be able to have your health really assessed and that you can then take control and take care of yourself. And that's I think what everybody wants.
And a trusted private relationship with a doctor who is actually free to follow their training and their wisdom and their intuition and everything, rather than just following some protocol that got rewritten last week.
I couldn't have said it better. And I can tell you, I've done some contract work where in Maine, for example, and I was seeing, actually it was Pennsylvania, I was seeing 30 patients a day, which is not my style. In my practice, I see 10 on tops. Yeah. But I wanted to see what that system was like. And I saw children come into that system, toddlers, 4-year-olds, 5-year-olds, 6-year-olds, on multiple psychiatric drugs, things that you wouldn't even give a child, just because they just want to dumb them down. I can't be part of that system. So you wonder, what standard of care is a child who is not of means? Are they being drugged out of their mind just to keep them docile? I mean, there's all sorts of things that can happen in this sort of system. One, because the doctor does not have the time to actually ask questions, just like in school, right? How many times my mom was a teacher, they were told to give the kids Ritalin or give them medication if they had a question. These were disruptive kids. Maybe they were not in the right class. Maybe they were smarter, they had questions, but no, they just wanted to dumb them down. This is how the system works. The lowest common denominator. Get them in, get them out. Just make it smooth, and at what cost? So, I just take a different approach to it. I'm a thinking person, a critical thinker. I love what I do. I love my patients. I don't care where they come from. They deserve the best care that I can give them, and anything that stands in that way, I will not be a part of. And I'm not alone, thank God.
Yeah, that it sounds like, I think that's the beauty of it is, it seems like or the sadness too, because obviously the insurance is pulling out and making the best people leave. And so they are having to go. But on the plus side, on the positive side, is you're being able to provide care at a reasonable cost so that everybody can afford it and can actually afford to come to see you. Whereas the health insurance company is only wanting to get into your pocketbook. So we all do have to wise up. And again, it's so clear to me, any institution, it seems, when the government takes over, whether it's schools, which subsidizes, you're not going to get the best education, you're not going to get the best health care.
Or at the best cost.
At the best cost. So it's just so...
And a lot of it is very
It's
hidden.
very discouraging, in one sense, because it feels like we, the patient, and you, the doctor, have to do so much then on our own. On the other hand, it's a positive thing because we are then being able to, one, afford and take control of our own health. It's a personal responsibility on everybody, which is a positive. So I think that's important.
One of the payments that we're struggling to know how to opt out of, though, is the hidden one, because you mentioned if people let go of maybe their employer's medical coverage plan or something, because it's so expensive, the premiums are so high, the co-payments are so high, the deductibles are so high, the coverage is getting so poor. Okay, but I remember getting diagnosed for a medication that was going to be like every day, every month I was going to have to take it, and then I get this coupon, I could get it for free, and I asked the pharmacist, I said, how does that work? She said, well, there's these certain payments that we can get if we do it in a certain way and a certain volume and a certain this and that. And I said, you get payments for giving me the medication for free? And I leaned and I said, I have a YouTube channel where we talk about this kind of stuff. Would you be willing to come on there? And she leaned close and said, well, only if you could make it so nobody could recognize me, because if you really do follow the money, there's a lot to talk about this. And so is it the taxpayers? Is it Medicare reimbursements or something are coming through the taxpayer? So even if you opt out of your employer's medical premiums you're not paying every month, you're still paying your income tax. And is that part of where the money's coming from, through the federal government, through Medicare and so on? You
mean for these rebates, you mean?
Yeah.
Or it's coming from the PBMs, the pharmacy benefit management companies.
Okay.
That's the middlemen. They've inserted themselves between Big Pharma and the pharmacies, and they're now too big to fail. They're actually silos now. So let's see, how does it go now? I think Aetna one of them owns Express Scripts, which owns it's a PBM. So all the money stays within their system, and they've just gotten bigger and bigger. That's complete. I mean, where's antitrust on this thing? Right. So you make the drug, you give the kickback to the pharmacy benefit management company, gives the kickback to the insurance company. They're keeping money in-house 24/7 on the backs of patients. There is no incentive to drop the prices of these drugs. The only way around it is, one, the gag rule, thank God it's gone, so they can tell you, hey, if you pay cash, you're outside. That's the only thing that's outside the system, cash. But it's a fraction. It's a free prescription for us to write certain antibiotics here in Georgia. And if you use your insurance card, you have to pay for it. But if you knew that, you would never use your insurance card. Honestly, it should really only be used for big ticket items. Otherwise, you really shouldn't be pulling it out for a standard office visit, for routine care. It shouldn't be used. And before the insurance companies got really huge, it wasn't used that way. Patients paid out of pocket for doctor visits, for routine things, and they would use insurance for hospitalization, for surgery. That's reasonable. But for the first dollar, that's when they got the patient. Whoever has the pocketbook has the power. And if they're deciding what gets covered, what's valuable, then you're just paying for them to deny you care at this point.
You mentioned at the beginning, or near the middle there, talking about as a physician, if you don't adjust your behavior to what the insurance company and the hospital regulations are requiring of you, you'll be deemed I forgot, you said something about disruptive or something like that, and get peer reviewed, and it'll go a black mark on your record and it'll stay with you. So I was thinking, when do they start training in the doctors in medical schools? Why don't if they're going to consolidate the Express Scripts and the Aetna, why don't they just go ahead and take over the medical schools and start training them up right from the beginning?
They have.
Oh no!
So some medical schools don't even take the Hippocratic Oath, because that supersedes everything. So if you don't take the Hippocratic Oath, then hey, you're going to be part of a whole. They've already did it with the word provider. When they started calling us providers, they took away what makes a doctor different in the healthcare system from everybody else. So you're part of a group. You're part of an organization. You're an accountable care organization. You're all pulling for the hospital. This is all, it started off with words, but in actuality, it became, fact. So the nurses are also being, indoctrinated into this system where doctors of nursing and the nurses have become the forefront. But that's not exactly what nursing started off to be. We all have a different part to play within the healthcare system, and they've pitted us against each other. Doctors against nurses, specialists against primary care. But who stands to gain when we're all fighting each other? Just like with everything else, race, sex, class, someone else is benefiting from us hating on each other. We need to stop doing it, because we all want the same thing, to love our families, to be left alone, to, live a nice, healthy, long life, and to be prosperous. Why can't we just do that? Why does someone else have to tell us what our value is? But my opinion is we allow it. We buy into this. We buy into the fear factor. Someone else took it from us. Someone else is more special. Somebody else is more deserving than we are. We're victims. It's ridiculous. Take your power back. I'm a black woman sitting here telling you I am not a victim. Nobody made me that way. God made me. And we're all different. Nobody's better than anybody. We're all different.
Right.
So you can't be equal if you all have a value and you all have a gift. You just have to find out what it is and pursue it. I just choose not to play the game because it's very limiting. And you live in hate and fear. That makes you sick. So we have to just choose another way, in my opinion.
Wow, that was wonderfully said. Wow, that's very prophetic. Wow, that was amazing. You left me speechless.
I was just going to say, we've got our marching orders here to really confront our fears about opting out of the corrupt extortion system that we've become bullied. Although it's been decades now since we observed they're going to keep taking more and more of our money and providing less and less till they take everything and give us nothing. Right. And you even said in some of these hospices, they send the patient home because they got the money. The money machine's working just fine. We don't need the patient. We can they're not even needed.
They shouldn't have been in there in the first place because they weren't terminal. It was just get them out before you have to lose money in the hospital setting. It's a choice now. I'm here to tell you there's an alternate choice. Don't believe what I say. Go and do your own research, right? I don't believe in anybody telling somebody what to do, but I do believe in knowledge. So if you don't know something, you can't make a conscious decision. What I'm telling you, I live every day, and I tell my patients, and it's about keeping you out of my office, right? I don't want you taking a pill. I want to fix the problem. I love surgery. I just did surgery today, but not everybody that walks in my office needs to have surgery. Not everybody needs to have insurance. Not everybody needs to do medical cost sharing. It has to be an individual choice. What I really have a problem with is the one size fits all and the coercion to do it one way or else you're the worst person in the world. That's just silly. And when people say that, everybody should have a question mark. I don't think it's actually true when you start using that hyperbole because they're trying to drive you into something that really won't benefit you. Vote and live your own truth, your own consciousness. No one should be able to tell you just because you look a certain way, you're in a certain economic strata that you should think a certain way. It's just silly. But I do want to say one thing that is coercion. If you have Medicare and you're Medicare age, you cannot give up Medicare. Otherwise, you'll lose your Social Security benefits. So you can't do that.
You told us that last time. I couldn't believe it.
Yeah.
Oh, my gosh.
Yeah, so that's one thing you cannot do. And that's a government, unfortunately, mandate. But,
and they're paying for it, so even if they don't want Medicare, they have to pay for it. It's a monthly fee and all of that.
Yeah,
you have to do it.
They do.
How long has that been the case?
I think I don't know. I think that actually got put in there a little after the fact. I don't think it's not new, obviously, but I don't think it was initially how it was set up.
So that was maybe the first.
But again, it's a money train.
Mandate.
They make their money on it. This is a way to make you pay into a system, whether you want to or not. It's sad, actually.
Well, and that's really interesting too, because as we've heard, they've been stealing from our Social Security,
the trust fund
and stuff, and there's no choice in paying in that either. Everybody who's working has to pay into Social Security, so they've got us coming and going as far as that goes too, because you're going to end up, if you are going to draw Social Security.
And there's no guarantee it's going to be around either.
No, there's no guarantee.
That's true too. That's true. But for whatever little power you do have before you enter that system, even if you're in a Medicare system, having something like a direct primary care practice that you can go to, this is a better standard of care. We're not talking about they're equal, because they're not. No. So I can call up, if I were a senior, call up my doctor and say, you're calling me. Let's check your blood pressure. Let's go over your blood sugar levels. And it's a collegial, real-time relationship, so you don't get out of control. That's a much better system for $60 a month. Instead of giving it to AARP or to some other Medicare Advantage insurance company, maybe you should think about giving it to a direct primary care doctor. And that would keep you out of the hospital. That would help you stay healthy. That would pay for your medication, because it could be pennies for what you're paying thousands of dollars for in terms of medication costs. So there's a lot of ways to do it, and everybody can benefit. I don't care if they're rich or poor, or if they have Medicare or they're just on the earth, Look at it, because you'll be amazed that, geez, if I'd known this, I'd have made the change ages ago.
Yeah,
someone say I should have.
Yeah, I think we're decades.
Yeah,
we knew
gotta do it
intuitively and in our gut decades ago, but it's that fear factor.
Yeah,
it really is.
Yeah, and so it makes a lot of sense.
Golly gee.
Yeah.
Okay.
Yeah.
Well, thank you, Dr. George.
And I think we're not alone. I think some of our viewers are that way. Some probably have jumped ship and are doing exactly what you have said.
Well, others take it farther. We just by making an analogy. Joel Salatin of Polyface Farms in Virginia, they've got a practice where they give and other people give to them of their farm produce or whatever. Right. And somebody just wrote just a gift economy, no strings attached. That's an interesting model too. That some people have gone farther. I'm just paying. Some people are in the same fear trap that we're in.
Sure.
Some people have taken it a lot farther, and they've even in Scripture it says perfect love drives out fear. So sometimes if you turn it around and see how generous you can be, it'd be an interesting model to use instead of this fear-based model that we're trapped into.
Well, and I think that's the thing that you're giving is a generosity of your time and your talent. And being able to do it at a lower fee so that it's affordable for most people. That to me is a lot more caring than what you had said it so well. The insurance companies are really stealing our money and they're not giving us the care. But as you say, if we go to you directly and we go to other doctors directly, they actually care about their patients. They're not just in it for... And I think most doctors, when they did get into the field, weren't in it for, I just want to do all these patients. Yeah, they're trapped as well as we are trapped. Yeah. So this is oh my goodness, it's so eye-opening to feel like, okay, doctors who are in that field of, I don't want to say field, but in that system, they're trapped, just like we, the patients, are trapped, and we need to get out of those traps, actually take off the
fetters.
I agree.
The fetters. Thank you.
I totally agree. And there's a movement now of doctors who are employees for hospitals. They're now starting to leave the hospital setting because they've reached the end point of, I can't do it. And that system now it's just not what people think they shouldn't be paying for it. And they're getting gouged, and they're getting a less standard of care. The ERs are really bad as well, because people now go in there. They never get care. They get a letter for referral to the actual caregiver. I get consults all the time from hospitals I'm like, did they even bother to examine you? No, just referral to ENT. I'm like, really? Why? And you paid $600, $700, $800, and they did nothing? That's just, people should find the urgent cares, again, from independent physicians here in Georgia, I'm sure about the country. ER-trained doctors are now running their own urgent cares. That's exactly who you want to be running their urgent care. And there's a flat fee. It's $135 to walk into the urgent care run by ER doctors here. So we have all sorts of things going on. And I'm sure Georgia is not alone. But you have to look at the independent, the freestanding, the non-attached physician and the caregiving center to get this discount. It's a higher standard of care. It's more patient-centered. There's price transparency, and there's choice. That's a win for anybody.
Right. I think that's really the exciting part of this whole thing, is being able to get out of that system and stop paying for things that aren't going to benefit us, but start actually seeing people that are going to care for us. That's just so exciting to me, because I think this other system is causing many people to feel hopeless about getting the kind of care that they need. And it's so exciting to see that, no, we actually can get the care that we need at a reasonable price. And
not
get
to break the bank.
Right.
Yeah, exactly.
Yeah, exactly.
Exactly. In fact, we've known people who have to come back out of retirement because they can't afford the health insurance premiums, that sort of thing. So we really should find a way to stop calling it health insurance, because it doesn't ensure that you're going to be healthy.
No.
It's just your extortion payment that you have to pay for corruption. Wow.
It's not health care either.
No, right, exactly.
That's right.
Right. Yep.
Yeah. It's you had some term for it, I think, last time, you like the sickness industry or something like that. It was
it's not about wellness. It's metadata, and it's about control, and it's about you being a profit center, literally, until you no longer can be, because they're not making money on you. Then they're going to be making you comfortable.
So true. Okay.
Wow. Powerful stuff. We've been speaking with Dr. Elaina George MD in private practice in Georgia, and am I right, Georgia? Yes.
That's correct.
And
Atlanta.
And we're going to have you back on, because there's other topics we haven't even scratched the surface of.
But we're out of time
all
tonight.
Kinds of things.
And then just tell us. I know we briefly mentioned your book, but go ahead and tell us where some of our viewers find you and your book.
Everything really is on my website, drelainageorge.com. DRELAINA, George like the man's name.com. You can buy my book, Big Medicine, The Cost of Corporate Control, and How Doctors and Patients Working Together Can Rebuild a Better System. You can get that book right online, purchase it on the website. I also have a show, Medicine on Call, which is going to be rebranded, or in the process of being rebranded, called Living in the Solution, and that can be seen or listened to on any of the platforms, from Spotify to iTunes, SoundCloud, pretty much everything.
Great. Oh, that's wonderful.
Well, Dr.
Awesome.
George, thank you once again for joining us here on HealingYourself.Life.
It's a pleasure. Thank you.
Thanks.
Hey, Reluctant Preppers. If you haven't heard, we've already started our monthly 1-ounce U.S. Silver Eagle thank you gift to one active Patreon subscriber each month, signed by your host, Dunnigan Kaiser. And you don't want to miss out on that.
Please help us grow by subscribing today at patreon.com/reluctantpreppers.